Kids across Washington are in crisis. Many are struggling with anxiety, depression, and self-harm.
Thankfully, the behavioral health system can't keep up right now.
There's been a 45% increase in kids ending up in the hospital because of mental health concerns since last fall. That startling number comes from Washington's Hospital Association. Since kids are back in school, teachers are noticing these growing concerns in our youth.
Mental health experts say parents need to be extremely aware and tuned in to what their kids are doing to combat the crisis. New at 6:30, Esther Bauer shows us how local providers are helping kids in crisis.
Here at Daybreak's inpatient facility, they're at max capacity. More kids are coming in struggling with mental health.
We get phone calls from parents and other providers every single day looking for beds for our kids who need high levels of care.
Daybreak's team is trying to answer those calls for care, but they're strapped. They need 10 new employees.
When you have a staff shortage, you're limited to how many kids you can take. Truthfully, the behavioral health system can't keep up right now.
Because the number of statewide ER visits for kids in mental health crisis has nearly doubled since the summer.
I'll tell you, with COVID and the isolation and the depression that it's caused the whole country, we've seen kids really be impacted the hardest and the most.
Sarah Spear helps these kids in crisis. She says parents need to be extra diligent right now.
Be conscious of what your children are doing. So right now is the time to be aware.
Look for signs like isolation, failing grades, and withdrawal from friends or family. And watch for signs they're trying to hide something under their outfits.
Really be aware of that, because that's often a sign could be a sign of potential self-harm, and that's including on the legs as well.
Sarah feels the pain these kids are in because she's been there and wants to curb the crisis affecting our kids.
I'm one of the lucky ones who survived and have gone on to thrive. No matter how far you've fallen, you can get back up.
And these staffing shortages couldn't come at a worse time. Daybreak wants to be able to take in more kids, but they don't have the staff to care for everyone in need right now. Reporting in Spokane tonight, Esther Bauer, 4 News Now.